About it was decided to give exactly to have consultation about parenchymal dystrophy, intracellular accumulation. Yeah. Just a second. Okay, first of all, let's start from your questions. If you have questions, please ask me. I will answer.
Teacher, I have a question.
Yes.
Please, like, we need materials, like good materials to study PathMorph, because the materials I'm saying, I don't think they're really strong enough for me or for our group. So if you can recommend any materials, like
the book or seminars.
Book, yeah. Because right now we're depending on our seniors' notes and workbook, which is not quite enough.
Minimum, what exactly should you use for preparing for exam? Yeah, it is exact lecture material. Yeah, pay attention to that classification, definition, explanations. Yeah, and also in library you can take a book. It was printed in Kharkov. It was redacted in Kharkov Medical University. Yakovtsova is the author, but even in our library as a student you can have it, you can take it. I don't have it. Yeah, if I find picture of this book I can send you exactly. What else? It is minimum. Yeah, for you exactly. Yeah, for your better imagination you have to search material everywhere. Like, as in truth, as a doctor, if every doctor, it doesn't matter which exactly specialization, it should be surgeon, pathologist, endocrinologist, cardiologist. If a doctor has some difficult patient with difficult situation, yeah, not clearly understandable clinical manifestation and diagnosis, yeah, doctor are searching everywhere, yeah, and you also have to do it, yeah. You can use also Robbins. I know that in pathophysiology you also, yeah, I
also have Robbins,
yeah, but it has less morphology. Yeah, also you can search exactly separate some pathology, exactly some pathological process and try to understand. First of all, in every book you can meet some different kind of explanation, yeah? And
yes, that's why, teacher. Actually, we have in all subjects we have a lot of sources, but some sources have like difficult information. So we need one source like we have simple information so we can understand everything easily.
Thank you. Like, teacher, about your Meta Plus, we had a different explanation, and you are looking for a specific explanation.
Why am I here exactly? Yeah, because my task is exactly to check your imagination about this disease, this pathological process. Yeah, how did you imagine? How did you understand from all your resources? Yeah, check it. And if is it wrong or right or in the way sometimes, yeah, students just have a part of this imagination have, and therefore to complete it or exactly to change this imagination in easier way. Yeah, it is exactly my task. Therefore,
when you ask us, we should to give you explanation by our explanation or the same
by your imagination, yeah, but I don't have enough time to, yeah, it's about every disease we can and every pathological process, yeah, we can talk a lot of, yeah, even a few lectures you can have just about metaplasia because it's And about every product, about atrophy, hypertrophy, about every of them, you can have even more than 2, 4, 6 hours lecture. And it will be correct. Everything will be correct. Yeah. And I don't have enough time. Therefore, I am going to check the main. What is the main? What is the main in your imagination? You have taken exactly from resources, medical resources, from book, from lectures. Therefore, I am asking exactly, not everything, exactly the main. In exam, you will complete, you will add more information, which exactly from the book, yeah. But the main, yeah, what should be fixated in your brain cells for your recognizing, yeah, the main. From them, you can recognize this disease, this pathology, from first moment, yeah. Because it's specifically for this process. Is it clear?
Yes,
Yes,
teacher.
teacher.
Also, some material, and also I'll send some, if I find nice lectures, I have sent you about hypertrophy, hyperplasia, yeah. Also, you can use this Britain book, this one, Pathology by Alan Stevens. It is also complete. You have to understand that every university, medical university, yeah, it has some scientific base, and usually in every book from every university, we can have just one nice, very nice chapter, because they are studying very well. For example, neurological diseases, and really neurological pathology is very fine in it, in one book. In another book, it's very nice cardiology pathology, yeah, therefore it's very subjective. By basic knowledge, basic explanation, you can find in every book of pathology, in every book. Some chapters, in every book, some chapters is very nice. But not I didn't meet already, unfortunately, yeah, the ideal book as for me. I didn't, yeah, just in one book, very nice cardiologic pathology, yeah, was given. In another, rheumatologic, some diseases, yeah, even some just separate chapters, just separate some pages very nice in book. As for me, yeah, it's very subjective. Maybe for you it will be another explanation, more easier for your imagination.
And the home tax, teacher, is too advanced.
What do you mean?
Like
Home.
the questions, most of the questions in the home tax is
According to
advanced.
the book, yeah, according to the lectures it was given. Usually the same material you can find in the lecture, what was exactly asking in homework, and in the book Kharkov, exactly, from Yakovtsova, I told you. If I find picture, I will send in group.
Thank you.
It isn't the best, but some material, and exactly our classification we need, yeah, exactly you can find, because you can be confused in some classification, because in different from different sides, yeah, some different pathologists exactly describe pathology. Okay, please closer to parenchymal intracellular accumulation. Yeah, do you have questions or not? Or I will start from exactly what was wrong in your answers.
Because cancer pearl. There's no information on cancer pearl.
Why no information? Where did you search?
I'm confused about Pesmo's body and cancer pearl. I can't understand. I felt it's the same thing.
cancer pearl and
Peshmo's body, like
no, different way. Cancer pearl, first of all, cancer pearl, it's very specific microscopical feature, microscopical manifestation in carcinoma, squamous keratinized carcinoma, yeah, which exactly develops, it can, usually, most often it's happens in the skin, but also in some mucosa, for example, in bronchi, in smokers. Even this carcinoma with cancer pearl can develop. Yeah? The main cancer pearl we can see microscopically, and you see pictures exactly. It looks like a pink color pearl. Yeah. Exactly, it is arrangement. Yeah, it is arrangement of the cells, epithelial cells, exactly tumor cells. The main, what should you understand according to our topic, parenchymal dystrophy? Yeah, it is accumulation, local accumulation of keratin with hyaline usually, keratohyalin accumulation. Therefore, pearl consists of keratin mostly. Also some added color because of hyperproduction of keratin from tumor cells. Is it clear or not?
doctor. Yes.
We will talk about it, about cancer pearl, also when we will study exactly oncology, it about tumors. When we will talk about tumor, we also exactly remind it. Yeah, but the main, what exactly you should understand right now from, because every dystrophy, every degeneration and dystrophy, it is the same. It is accumulation of substances. Yeah, is it understandable or not? Is it clear?
Yes,
Yes.
doctor.
Yeah, dystrophy, it is excessive accumulation of substances because of metabolic disorders. Yeah. It happens intracellular, just inside in the cells. We can see this excessive amount of substances in parenchymal dystrophy or intracellular accumulations. Yeah. And what else you have to understand from this topic? Yeah, every dystrophy, it is accumulation of substances. Every degeneration means. Yeah. There are 4 mechanisms how exactly this excessive amount of substances could be accumulated. 4 mechanisms. It means 4 ways. How does this excessive amount of substances come into the cell? From where? It is the main in every mechanism. Because result in every mechanism, it is accumulation of substances in the tissue cells or exactly in organ. There are 4 mechanisms. Do you remember them?
Mm-hmm.
Name.
Infiltration, decomposition,
Transformation,
and
abnormal
transformation.
sentences.
Yeah, okay. Infiltration and decomposition, very often they develop together, one by one. Yeah. Firstly can be infiltration, and a little bit later develops decomposition. Or in another way, firstly in some diseases develops decomposition, but always a little bit later develops infiltration. Infiltration, it is accumulation of substances, excessive amount of substances inside in the cell from blood and lymph. Yeah. It means that firstly, patient has high level of these substances, too much these substances in the blood. Yeah. For example, in atherosclerosis, abnormal diet disorder, yeah, excessive amount of cholesterol comes from food, and patient has hypercholesterolemia. Yeah, hyper means increasing cholesterol, emia blood. Yeah, hypercholesterolemia means too much cholesterol in the blood. Is it clear?
Yes, teacher.
Yeah. Okay. And excessive cholesterol starts to go inside in the vascular wall and stay exactly in it. Yeah. Firstly, it doesn't accumulate because of normal function of cell. Yeah. For dystrophy, if it is healthy cell, healthy tissue, yeah, excessive amount of substances will be destroyed because of increasing production of enzymes. If this cell is healthy, it increases production of enzymes, destroy excessive substances, and therefore it stays a healthy cell. Yeah, but it happens exactly firstly, yeah, if in stress, in some toxic effect or something else. But if it is prolonged, if it is continuous, yeah, it means that too much substances, yeah, from the blood in infiltration, yeah, come into the cell in some period, yeah, because of hyperfunction, cell becomes exhausted functionally, yeah, and it can't produce too much more than normally enzymes for destroying of the excessive substances. And in this situation, we can see enzymopathy. Therefore, in your definition, even you can see that dystrophy, it is accumulation, excessive accumulation of substances in the cell, extracellular matrix, yeah, organ tissue, because of disturbed synthesis and enzymopathy. Enzymopathy, it means deficiency of enzymes, not enough enzymes, which could destroy these substances. And these substances are not destroyed and accumulate, stay inside in the cell. And if it continues, therefore, more and more substances accumulate in the cell. And we can see this excessive amount of substances. In this situation, we can put diagnosis of dystrophy or degeneration. Is it clear? Because I don't understand to who I am talking with.
Yes, it's clear, doctor.
Yeah? Are you with me or not? Because
Yes,
we're
teacher.
very quiet here. Okay.
We're listening to you.
Infiltration. Yeah, infiltration if substances come from the blood, like for example in atherosclerosis, yeah, from blood or lymph. If another second situation, yeah, in decomposition, or another name of this mechanism, phanerosis, yeah, excessive amount of substances accumulate because of cellular structures destroying. Yeah, it means that it was healthy cell, but in one moment, structures, cellular structures like mitochondria, lysosomes, endoplasmic reticulum, yeah, and other structures are destroying. But all of them are they consist of membrane, and membrane consists of, what does it consist of?
Lipids,
It's
protein.
Yeah, bilayer, two layers of lipid. Yeah, it's like sandwich, and inside some proteins inclusion. Yeah, but mostly it consists of lipids. Because of destroying of membranes, lipid from membrane become free, yeah, and accumulate inside in the cell. It will be decomposition mechanism. Can you give me example? When can it possible? In which situation? Yeah, in one moment, exactly these structures can start to destroy. When can it possible?
Saravskin.
Teacher, in cachexia,
Irreversible cell injury.
or whenever
accumulation?
there is
Dystrophy or accumulation, it is kind of injury. Because injury, there are three processes is injury, dystrophy or accumulations, yeah? What else? Necrosis and apoptosis. All of them are injury.
Necrosis.
Necrosis, it is the end. But I'm asking about mechanism. When healthy cell, it was healthy cell, but in one moment, for example, mitochondria inside in the cell start to destroy.
due to
When can-
hypoxia.
In hypoxia, yeah, very nice answer. In hypoxia, not enough oxygen. The most sensitive structures to hypoxia are mitochondria. Yeah, and mitochondria, firstly, they swelled, yeah, because of oxygen absence, yeah, and start to destroy. What else can lead? Also, inside in the cell can come virus. Do you remember? Yeah, virus is intracellular parasite. Yeah, intracellular microbial agent. And it can go inside in the cell and destroy it. In viral infections, exactly this damage, tissue damage happens because of decomposition. Is it clear?
Yeah, teacher.
Or toxic substances, toxins, yeah, for example, some poison was given, yeah, or some toxic substances was in because of kidney failure, too much toxic substances, yeah, in the blood, and these toxic substances go inside in cell and destroy membranes, destroy structures, and inside in the cell start accumulate substances. It will be decomposition, yeah. Infiltration are combined with decomposition very often. Why? Because if, for example, firstly, substances, excessive amount substances come from the blood and accumulate inside, yeah? Firstly, these substances, these inclusions, cellular inclusions, dislocate others, structures because they need space for accumulation, yeah? And they press and push and dislocate others, endoplasmic reticulum, mitochondria, press them, and because of pressure, mechanical pressure, this mitochondria and the plasmic reticulum after some time start to destroy. Therefore, in this damage, it was firstly infiltration, but a little bit later, yeah, it was progression of this injury, and also decomposition was combined in it, yeah, it was added to it. Next mechanism is transformation. Yeah, it's like a toy transformer. Have you seen a toy transformer, or even
It's
movie? It was, yeah. It means transformation. If something one change to some another, yeah. Transformation. It's like a miracle. From the car, we can see something else, yeah. And for example, plane or something else, yeah. Transformation, it means that one substance, it was accumulated one kind of substances, yeah. If one substance come inside, but from that substances appear another substances. For example, yeah, if we decide and if we eat too much bread, what happens? What should we expect? Too much bread, some cakes. What should we expect?
Carbohydrate decomposition.
Maybe his cell.
Girls should know, but boys also.
Carbohydrate deposition. There will be too much of carbohydrates.
No,
Okay.
I'm asking about the life.
belly fat.
Stomach ache.
Yeah, if girl eats too much cakes and bread, what should we expect after a few months? What should happen with this girl?
Obesity.
Your stomach. Boof.
Obesity. But obesity, it is fat accumulation, right? And the bread, it is carbohydrate.
Carbohydrate.
Yeah.
Yeah.
Refined carbs.
And it means that carbohydrates can transform in fat. And exactly in obesity, caused by too much carbohydrate, for example, carbohydrates in food, yeah, because of transformation, we can see fat deposition, fat dystrophy, yeah. Is it clear?
Yes.
Clear, but I have a question.
Yes.
Why is it only observed in only women?
Not women, yeah. I think that because you were quiet, it should be in men also.
Yeah, but you were like, women should know. I was like, okay, what's going on?
Because women usually are very, very polite to the weight and to check the weight. Therefore, but boys also, yeah. Okay, is it understandable? Yeah, is it clear? I want to
Understood, yeah.
some feedback from you. Therefore, I am asking.
Yeah, understood.
Okay, and the last mechanism is abnormal or reversible synthesis, yeah? Abnormal synthesis, it means that a cell starts to produce not typical abnormal substance. This substance could be abnormal for organism, for healthy person at all. Like, for example, amyloid. Amyloid we shouldn't find in healthy person. It is abnormal protein, which exactly appears because of abnormal synthesis. Yeah, amyloidosis disease, which is characterized by accumulation of it. Or it could be, because of abnormal synthesis, could appear and accumulate not typical some substance for this tissue. Yeah. For example, in alcoholic hepatitis, hepatocytes, because of alcohol, exactly, ethanol effect, yeah, hepatocytes in the liver start to produce hyalin. But hyalin mostly, which kind of tissue consists of hyalin? Just one kind of cartilage. Should we find hyalin in the liver?
No.
No. Yeah. Why does it happen? Because of abnormal synthesis. Yeah. Because in alcoholic hepatitis, this hyalin exactly produced and accumulate. It is accumulated inside in the cell. It looks like pink dense inclusions, yeah, and it has very specific name. Do you remember? Do you know what name does it have, this hyalin inclusions in alcoholic hepatitis?
This is Mallory bodies.
Mallory body, yes, of course. Mallory body. It is intracellular deposition of alcoholic hyalin because of abnormal synthesis, and it happens in alcoholic hepatitis. Is it clear?
Teacher, I want to ask that how that carbohydrates get transformed into fat in that transformation one. You told that if the girl is consuming a lot of cake and bread, so how it was transformed?
How it works, you should ask biochemistry teacher, because it's chemical process, it's chemical reaction. Too much carbohydrates, they connect to each other and transform into the fat.
Okay.
Is it understandable? It is biochemical reaction.
Okay.
Okay, what else? What another questions do you have?
Fibrinoid swelling as an example of the transformation, because like in the fibrinoid swellings, like collagen fiber are destructed, and in the place of collagen fiber we have the fibrin. So can we consider it as a transformation?
Not clearly transformation, because it is coagulation. Yeah. You have to know two kinds of protein changes. And you know that in our tissues, exactly protein, it is the main substance, yeah? Because of membranic structures, yeah? It exactly make a shape, edges of cell and tissues, exactly proteins, yeah? But two conditions of proteins could be. Normally protein, it morphologically look like, but I think that you saw and you can imagine, yeah? Have you seen a free egg?
Yes, ma'am.
Egg.
Yes, ma'am.
E-double-G.
Yes.
Yes. Have you seen egg? Yeah.
Yes.
Did you broke it?
Yes,
Did you
ma'am.
break it? Yeah.
Yes.
And exactly protein, it is external part. It's clear protein. Yeah. How does it look like in free egg?
Viscous, mucoid.
Yeah, it is jelly-like, yeah, viscous,
Yes.
clear, transparent, yeah. It is normal morphological appearance of protein, yeah. But two kinds of changes, two ways of exactly the protein transformation, not transformation, exactly changing we can see, yeah. If we boil egg, what kind of changing should we expect in protein? What happens if we boil it?
It's become semi-solid.
Solid.
It becomes firm, dense,
Yes,
dense, and
and the color changes. The color.
dry.
Right.
Yeah, color, yeah, could be changed in this situation. Yes, but not always. But first of all, it is dry. It isn't watering because it lost water because of boiling. Yeah, and it becomes dry and dense. And this dryness and denseness of protein in medicine name as coagulation. How can we, for example, to prevent bleeding in surgery manipulation, yeah, we use electrocoagulator, yeah. It is like metal, some metal instrument, yeah, electronic instrument, which exactly because of high temperature coagulate vessels. Is it understood? And stop bleeding, yeah, happens. Coagulation, because of high temperature, exactly coagulation of vascular wall protein lead to exactly like disappearance of vessels, blocking of vessels, because coagulated proteins blockage these vessels and stop bleeding. Yeah, happens exactly in surgery manipulation. Therefore, coagulation in excessive amount of protein. In some situation, we can see coagulation of these proteins. They are accumulated and coagulated. It leads to some dense, dry, granular depositions inside in the cell. We could be interrupted. Therefore, after, if we are interrupted, we will continue. We will connect again. The same link. About coagulation, yeah, therefore, and if dystrophy, if these accumulations progress, yeah, continues, what should we expect? What happens with cell, tissue in progression of dystrophy?
Will destroy.
And how should we know? According to cell, what does happen with cell in the end?
Cell death.
Death. How should we name cell death?
Necrosis.
Necrosis or apoptosis.
Apoptosis.
Every dystrophy, yeah, every dystrophy, like in first moment, it is reversible in start of this process, yeah. After some time, it becomes irreversible, and irreversible dystrophy always leads to necrosis. If it was yeah, and dystrophy can be, firstly, it not can be, it always, firstly, in first moment, it is reversible. Yeah, if we start treatment, therefore it will be very favorable outcome. Yeah, but after in prolongation of this stress or some another effect, it becomes irreversible. And every irreversible dystrophy leads to necrosis. Is it understandable? If cell in exactly, yeah, with irreversible dystrophy, it will die always. Is it clear?
Teacher, it will
No.
lead to necrosis or apoptosis.
Thank you.
Necrosis.
Why?
Only necrosis. Apoptosis is physiological death.
Okay, the natural death.
Injury always lead to necrosis because it is early death. It isn't physiological. It isn't programmed. Yeah. Yeah, pathological death. Okay, therefore, if this pathology, exactly this problem was started from protein accumulation, and protein are coagulated, they become dense, dry, and accumulate in cell. Yeah, in the end, we should see exactly coagulative necrosis, or it has another name, dry necrosis. And in truth, it's exactly dry because tissues, organs, where exactly does it happen, becomes dry. Is it clear?
Yes, ma'am.
Dry, dense, and
So, teacher, when it leads to necrosis, dry necrosis, what are the physical, like, what can you see, and how will you notice this? I don't know how to put it.
we can see some dry masses. Yeah, for example, if it happens in the skin, it happens in the skin always because the outer layer of the skin, epidermis, yeah, it is exactly these dead cells, dead keratinocytes with too much keratin coagulated inside in the cell. Yeah, and cell becomes a dry particle. Yeah, and a lot of these dry particles exactly make epidermis. If too much, exactly, yeah, increasing amount of, if it happens, for example, coagulative necrosis, too much necrosis, yeah, it leads to thickening of epidermis. Yeah, this condition is hyperkeratosis. Yeah, in this situation, we can see some dryness of the skin, local dryness of the skin. Yeah, it looks, for example, like in psoriasis. Yeah, have you seen psoriasis? Like or ichthyosis. It looks like fish-like.
Skill, body.
Yeah, skill.
Yeah.
Yeah.
Understood.
But it's exactly coagulated protein. We can see clearly. Yeah, it looks like in tuberculosis, but we will talk about it also. For example, this coagulative necrosis. Yeah, necrotic masses in the lung. It appears area of necrosis. It looks like cottage, dry cottage, whitish color, and it really looks like cottage. Is it understandable?
Yes, teacher. It is.
Okay, this one kind of changes. Yeah, another kind of changes of proteinal changes. It is colliquation. Yeah, if we leave the egg in normal temperature, yeah, like 42, not 40, sorry, 20, 24, 27, 28 points, yeah, it will lead after, for example, 1 or 2 weeks. If we break, exactly, if we cut this egg, what can we see? We can see instead exactly proteinal part, instead these proteins water, a little bit water.
Yes.
It will be unpleasant smell because of exactly yolk changes. Yeah, but now we are talking about exactly protein. Watering of protein is colliquation. It's watering or hydropic changes. Yeah, hydration. In this case, if it happens, yeah, it depends on which kind of protein was accumulated in it, yeah, because enzymes are also proteins, and if too much enzymes are accumulated in cell, it leads to destroying. It can happen if lysosomes are destroyed, because enzymes, yes, the main amount of enzymes are located in lysosomes. Lysosomic enzymes start to destroy structures, yeah, another strand nucleus, endoplasmic reticulum, yeah, and because of pH changing, too much water absorbed from extracellular matrix inside in the cell, and we can see like swelling, watering of the cell. The name of this condition is colliquation. It is opposite kind of changes, and it leads to colliquative necrosis. Colliquative or wet, moist necrosis, yeah, wet necrosis. Therefore, two morphological kinds of necrosis: dry and wet. Because morphologically, macroscopically, we can see that in some pathology, dead tissue is dry, in another, dead tissue is wet, moist. Is it clear?
Yes, teacher.
Yes, okay. Therefore, tell me, please, what dystrophy, what proteinosis are characterized by colliquative changes, and what proteinosis are characterized by coagulative changes?
Coagulative is hyaline
hydropic
protein
dystrophy is
and colliquative is hydropic.
Yeah, hydropic dystrophy characterized by colliquation, and colliquative necrosis will be in the end, yeah. In hyaline drop, yeah,
It
it
is
was,
coagulative in hyaline drop.
yeah, coagulative necrosis and coagulative changes and coagulative necrosis develops. But you know two more proteinosis.
Also, keratinosis will be coagulative.
Yes, keratoid dystrophy characterized by coagulation, yeah. And one more, the last one.
Ichthyosis will also be coagulative.
But it is example, it's a subtype of keratoid. And granular dystrophy also.
Granular dystrophy.
Granular dystrophy, which kind of protein changes? Is it coagulation or colliquation in it?
It will be coagulation.
colliquative.
Yeah, coagulation, but
Coagulation.
granular dystrophy is reversible. Exactly, granular dystrophy is reversible. These grains, small grains, which are, they are coagulated protein, yeah? Looks like very small granules. Okay, is it clear?
Rest all will also be reversible, na? Hyperkeratinosis or hyaline drop or hydropic, they all will be reversible.
In the start, hydropic dystrophy, yeah, in the start it is reversible, but a little bit later it is irreversible, hydropic dystrophy. The same hyperkeratosis. It could be reversible, yeah,
What about the hyaline drop?
Hyaline drop, it is irreversible, and very often it develops because of granular. It means that firstly, yeah, we can see granular dystrophy, and in progression, granular dystrophy becomes exactly hyaline drop dystrophy.
Teacher,
Because-
when we are, sorry to disturb, when we are talking about coagulative necrosis or colliquative necrosis, it's like the outcome of granular dystrophy.
Every necrosis
Is
is
an outcome.
outcome of dystrophy. Yeah.
That's why we're seeing them in hyaline drop and granular dystrophies.
No, if we see dystrophy, therefore cell is alive, but necrosis will develop earlier.
When it's dead.
Means that no, it will die maybe after a few days, yeah, but not as normal, earlier than normal. It means, like, for example, we can see old people, yeah, and we understand that old people, 80, 90 years old, yeah, he or she will die, yeah. It is rule of our life, yeah. For example, if two 90, for example, here 90 years old people, but one has a chronic kidney failure, chronic heart failure, yeah, and chronic hepatic, for example, liver also dysfunction, yeah. Another second person, 90 years old person, he don't have severe diseases. We can imagine which of them will die earlier. Which of them?
One with
the disease.
With diseases, yeah. The same according to cells. Dystrophy, it's like disease for cell. It will die earlier than another cell, normal cell.
But teacher, it is a bit confusing. Like dystrophy earlier, it is reversible and then it becomes irreversible. So
Yes.
like the parts of it, like granular, you told it is reversible. So it should be also reversible earlier and then it should be irreversible.
Hyaline drop?
Yeah, then it should also be reversible. and
Hyaline
then-
drop? No. Hyaline, the difference between granular and hyaline drop dystrophy, it is size of this coagulated protein. Because in granular, we can see very small grains. Yeah, very, very small. It looks like sand. Looks like sand, yeah. But after deposition, which is other, this sand, these particles becomes grains, big grains. It means that granular and hyaline drop dystrophy are stages.
Okay. So first
Is it
will be
understandable?
granular.
When we can see big grains, like for example, it looks like pearls inside the cell, yeah, and this deposition, this dystrophy is irreversible because too much protein, and this protein can't be destroyed. It's impossible to destroy it, and it will not disappear.
Okay. Okay, teacher.
Is it clear?
Yes.
Yes,
About
doctor.
proteinosis, yeah? Okay, let's talk about one of the example of hyaline drop dystrophy is Mallory body. Yeah, Mallory body, it's a pink color, a grain exactly inside in the cells. In what disease? What disease is characterized by it?
Alcoholic hepatitis.
Alcoholic hepatitis.
Alcoholic
Alcoholic
hepatitis.
hepatitis. What mechanism does lead to it?
Sure.
Deposition of
What mechanism?
Hyaline drop.
Abnormal synthesis of ethanol.
Mechanism.
Abnormal
infiltration.
synthesis of ethanol.
Abnormal synthesis. Infiltration if it comes from blood.
Okay.
Can we see hyaline in the blood?
No.
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 It appears in hepatocytes because of abnormal synthesis. Hyaline shouldn't be present in the liver. Okay?
Okay.
Next, about keratoid dystrophy. Keratoid dystrophy, it is a disturbance of keratin. Keratin, it is specific protein, specific for skin.
Yeah.
We can see this protein just in the skin because epithelial cells, keratinocytes, produce this protein. Yeah. Okay, and you have to know four examples, four kinds of keratoid dystrophy.
Hyperkeratosis.
Hyperkeratosis,
Cancer pills.
Ichthyosis.
Leukoplakia.
ichthyosis, leukoplakia, and
Cancer
Cancer
pearl.
pearl.
about cancer pearl, we have talked already. Yeah, hyperkeratosis is thickening of epidermis because of excessive amount of keratin.
Teacher, can
It
you
is
explain cancer pearl
local.
once again?
Hmm?
Cancer pearl, can you explain it once again?
Okay. After leukoplakia, I will explain. Is hyperkeratosis clear or not?
Yes, teacher.
What mechanism does it lead?
Transformation.
Transformation. Why?
Synthesis. Disturbed synthesis, ma'am.
Yeah.
Disturbed synthesis is synthesis of abnormal substances. Is keratin abnormal substances for skin?
No, ma'am.
No, this is normal.
No. Can it be abnormal synthesis?
No.
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 No. Deposition.
No, it's transformation.
Mechanism.
Transformation.
It's transformation.
Transformation. Why?
Because the skin transform.
The keratin substance is transformed.
Some epithelial cells transforms to keratinocytes that produce keratin. No?
Yeah. Normally keratinocytes produce keratin. Yeah. But in hyperfunction, we can see hyperkeratosis, too much keratin. It means the cells produce more than normal. Yeah. And where did it take? Because every cell produces substances from reserve substances, from basic substances. Yeah. Is that understandable or not?
Yes, ma'am.
Yes. For example, yeah, normally keratinocyte use proteins, all proteins, which exactly come inside in the cell, yeah, and produce from them keratin, the specific function of keratinocyte. But in pathology, it means that situation which exactly cell needs to make keratin more than normal. Yeah, not, for example, not 100. Yeah, it produces 200 protein molecule. Yeah, where did it take material for it? From everywhere. It means if function should be increased, yeah, it means that cell take all resources from all other substances. It means that for another function, yeah, it will take from them to make keratin, because it needs, in this pathology, it needs to make more and more keratin. It means that from other substances, which usually the cell use for another function, yeah, it used for making keratin. Is it understandable?
Yes.
Transformation, yeah, in hyperfunction, exactly, we can see it. Okay, next, leukoplakia. What is leukoplakia? How did you understand? Not fully complete answers I saw from your classwork.
Of stratified squamous epithelium.
When there is deposition of
Where
keratin
exactly?
on
Where
mucous
exactly can we
membranes.
find leukoplakia? Where?
In the mouth?
On the mucous membranes, non-keratinized.
Yeah.
In mucosa. In
Okay.
mucosa. Yeah. In oral cavity, in cervix, in vagina, in everywhere. In mucosa, exactly. In esophagus, in bronchi. Yeah. In mucosa. What tissue is mucosa?
Famous.
Mostly, if you are talking about, for example, oral cavity and
Granular
vagina.
epithelial.
No,
Which epithelium?
non-keratinized epithelium.
Squamous, non-keratinized epithelium. Yeah. Skin, it is keratinized epithelium. Keratin, it's normally exactly produced from that cells. Yeah. And mucosa in oral cavity, it is squamous epithelium. Yeah. But not keratinized. Normally, keratin doesn't produce exactly in it. Yeah.
Yes.
Is it clear?
Yes.
And leukoplakia, it is keratinization of mucosa. It means that keratin appears in mucosa. Yes?
Yes.
Can we see? How does it look like macroscopically?
Whitish plaque-like gray.
Yeah,
White
it's like
patches.
plaque. Yeah, plaque. It is dry. It's outstanding a little bit. Yeah. Patient has some discomfort because he can feel it. Yeah. And it has whitish color. Yeah. Okay. And you wrote it. It is correct. Yeah. But what processes it? We have talked already that mucosa in oral cavity, yeah, it is exactly is covered by squamous, not keratinized epithelium. But in leukoplakia, we can see some area with keratin accumulation. What does happen?
Abnormal synthesis.
Yeah, it is abnormal synthesis. Why does it happen? Because in truth, yeah, in mucosa we can see, no, we can see area of squamous keratinized epithelium.
Yeah.
What does happen in it? Because we have studied already this pathology, and you have to connect your knowledge from different topics.
Metaplasia.
Metaplasia, yeah, it is example of metaplasia. What is metaplasia? Remind me.
When one type of mature cell transform into other type of mature cell of same origin.
Yeah, same happens here. Yeah, it is normal. It was normally, yeah, it was non-keratinized epithelium, but because of some in smokers very often it happens. Yeah, because of pathological effect, because of stress. this area transform into keratinized epithelium. It is
Doctor,
Is it?
metaplasia was reversible. Here,
Yeah.
leukoplakia, is it reversible?
Yes.
It's a dystrophy.
Yeah, it is dystrophy and it is metaplasia at the same time, and it is reversible. But in progression, metaplasia can lead to
dystrophy.
No, it is dystrophy.
Metaplasia can lead to dysplasia.
To dysplasia. And the dysplasia, what is it?
Precancerous.
Precancerous. And dysplasia later can lead to carcinoma. It is malignant tumor. And it will be which kind of carcinoma? Keratinized kind, because keratin was produced by tumor cells, yeah? Not tumor, but in progression, these cells will replace by tumor cells with keratinization, and they will produce too much keratin, and keratin will accumulate inside in epithelium, and microscopically it look like pearl, pink color, very dense, dry depositions, yeah, which exactly through tumor cells. Is it clear or not?
Yes, teacher.
Yeah, and for example, histologically, we can take biopsy. We can see some white patches, yeah, in oral cavity. We should take biopsy, and microscopically, if we see in this area squamous keratinized epithelium, yeah, what diagnosis should we put in it? What diagnosis is it?
Leukoplakia.
Leukoplakia, metaplasia, and leukoplakia. If we see cellular atypia and disarrangement of epithelial layers, what diagnosis is it?
Hyperkeratosis.
Dysplasia.
Dysplasia. It is dysplasia. Cellular atypia and disarrangement of epithelial layers.
From basal to surface.
Of dysplasia, yeah. And if we see microscopically cancer pearls, what diagnosis should we put?
Carcinoma.
Squamous cell keratinized carcinoma.
Okay, teacher, then this leukoplakia, it can further lead to cancer pearl if it goes on accumulate.
Yeah, but it is reversible because it is metaplasia. If we start to treat, it will replace by normal epithelium.
But cancer pearl is carcinoma, no? So it won't be reversible. It will be irreversible.
Carcinoma, yes. Without treatment, leukoplakia, after a few months or a few weeks, leads to carcinoma, to cancer pearl appearance. And in this case, it is carcinoma. And we should remove it and also use radiotherapy, chemotherapy, yeah?
So, teacher, cancer pearl is irreversible, but leukoplakia is reversible.
Yes.
Okay.
Is it clear?
Yes, teacher.
Yes, teacher.
Yes. Okay, very nice. Next, what should we talk about? It is ichthyosis. Ichthyosis is general hyperkeratosis. Yeah. Hyperkeratosis, it was local, just in some portions, in some areas of the skin, we can see thicker epidermis than normal. Yeah. But if it happens everywhere, in all skin.
It's
Yeah?
general.
It is genetic. It is genetic disorder. It is congenital disease, ichthyosis. It's like ichthyoandr, yeah, because it's fish-like skin everywhere.
Deformation.
Okay, is it clear? Do you have questions about proteinosis?
No, teacher.
No. Pay attention, because in every, like you saw, in every pathological process, some disease, I am asking what mechanism does lead to it, you have to remember this 4 mechanisms: infiltration, decomposition, transformation, and abnormal synthesis, in every pathological, in every dystrophy. If you are talking about dystrophy, you have to imagine which mechanism does lead to it,
Yes,
So
teacher, understood.
Yeah.
Ichthyosis will be abnormal synthesis.
No, transformation also. Because it is normal substance for skin. Okay. Next, fat dystrophy, fat accumulation. In fat accumulation, you have to know, first of all, macroscopically, changes we can see sometimes in some different organs, some specific changes. For example, in the heart, it will be tiger heart, Usually it is yellowish of tissue because of fat, excessive fat accumulations, For microscopical investigation of fat deposition, you have to know, but I didn't see, you didn't search, and you didn't send me microspecimens. I don't know why, of different kind of investigation of fat deposition, because minimum 4 methods you have to know how can we identify. Because usually if we take biopsy or if we investigate some material microscopically, we use standard staining. What are they?
Sudan 3, Sudan 4.
Usual staining.
Nile blue sulfate.
You have to know from histology.
Log sulfates.
First of all, if you take material for microscopical investigation, what staining should we use?
Sudan 3, Sudan 4,
Sudan.
Nile blue sulfate, oil redo, oxalic acid,
Lean.
scarletin. टीचर कहाँ गई?
Are you
Hello,
here?
teacher.
Hello again. Sorry, my Wi-Fi is joking a little bit.
Yes, but I think it's better to make another meeting because it will finish now.
Yes.
Okay, let's continue. What was the last?
Method of staining.
The staining.
Good. Yeah. I'm asking exactly about the standard. Yeah. Standard staining which we use for microscopical investigation.
We have Sudan.
Sudan 3,
Chemotaxilin, HE stain.
Yeah. H and E, hematoxylin and azine. It is standard. First of all, every microspecimen, yeah, in hematoxylin and azine staining, we investigate. Other staining, there are additional staining, yeah, and we will use other staining later after we investigate exactly in hematoxylin azine. But hematoxylin and azine need to use spiritus before staining. Yeah, if you take spiritus exactly, you know that it is alcohol delat usually. Yeah, it is destroy lipid. And in hematoxylin azine staining, we cannot see lipid. We can see just because of disappearance of lipid, we can see empty vacuoles in hematoxylin azine staining. But tell me please, in which situation or in which dystrophy it could be fatty dystrophy, but also what dystrophy also is characterized by empty vacuoles deposition.
Hydropic.
Hydropic. In hydropic dystrophy, we also can see these vacuoles. Yeah. And we have to identify. Yeah, we have to identify what substance exactly is it. Is it water, like in hydropic dystrophy, or it is fat? For that, we have to use additional stainings, yeah, and you have to know minimum 4 stainings specifically for fatty deposition, for fat. I'm waiting for your answer. It was a question.
Sudan 3, Sudan 4, Nile blue sulfate, and eosine hematoxylin.
Osmic acid, black
Osmic acid and Charlach. Можно.
Charlotte.
Charlach.
Teacher, can you
But
spell
they,
Chal is red in color, right?
yes.
Char.
Sudan 3, which color should we find?
Red.
Red color.
Orange. Orange, yellow, orange, till red. It depends on how much lipids are accumulated, yeah? Yellow, orange, usually, exactly, mostly yellow, orange. Osmic acid?
Black in color.
Black. Pay attention, yeah? In Croc tasks, every year you have a task about fatty dystrophy in the liver or in the heart. It is described exactly, yes, the description you can, and one from the 2 staining usually in the task exactly it was given. It is given exactly, yeah. Sudan 3 or osmic acid. Therefore, yeah, Sudan 3 and osmic acid you should fixate in your brain cells very deeply. Yeah, is it clear?
Yes, teacher.
Yeah, one more time, tell me what color should we find in Sudan 3 using?
Yellow, orange.
Yellow, orange.
Yellow, orange.
Yellow,
And
orange.
osmic acid?
Black.
Black.
Black. Yeah. If we take, for example, osmic acid staining for investigation, and we can see black vacuoles, therefore the conclusion should be fatty degeneration. Yeah. About if fatty deposition develops intracellular, develops in the liver, it is goose liver. Goose liver, because it has some yellowish color, it becomes softer. Yeah, therefore the liver is enlarged, edges are rounded. It means that liver, yeah, because of enlargement, it becomes a little bit rounder. It is softer than normal, has softer consistency. Yeah, yellowish color, yellowish orange, like, yeah, brownish or orange color.
Saffron.
And in cut surface, if we cut this liver in cut surface and in the knife, we can see fatty drops, because we cut and we dissect cells, and we dissect exactly this fat accumulation, and fat drops stay in the exactly in the surface of the knife, and we can see that it is fatty. Yeah, is it clear?
Yes, teacher.
Yes, microscopically we can see fatty vacuoles, and it should be different. It should be small drop, yeah, from the small, middle drop, or big drop dystrophy, yeah, according to the size of these vacuoles. It is about goose liver. Yeah. Okay. Usually we can see it in hepatosis, chronic or acute hepatosis. Acute hepatosis has name toxic liver degeneration. I think you saw it in your home task, in workbook it was given, yeah. In this situation, liver is critically enlarged and it has bright yellow color in toxic liver degeneration. It is acute hepatosis as disease, and it happens because of poisoning, usually in intoxication, yeah, and mushroom poisons, mushroom using, for example, or critical intoxication, yeah, in some severe diseases, infection diseases, for example. Yeah, and exactly goose liver, which we have described a little bit earlier, it is chronic hepatosis, which has another name, steatosis. Steato, it means lipid, fat. Steatosis, yeah. Pay attention, because very often, according to disease, which is characterized by dystrophy, characterized by deposition, accumulation of substances, if we create the name of disease, in the end, we use as ending in the term, we use osis. Yeah, and we can make it as, for example, we can take tissue or organ and add osis, like, for example, hepatosis, nephrosis. Is it clear? Yes. Or another way to make exactly the term, we can take substance and also add oses. For example, lipidosis, glycogenosis. Yeah? Is it clear? Hyperkeratosis. Is it clear or not?
Yes.
Yes, ma'am.
Yeah, it is about nomenclature. It's also it's very important, yeah, because you have to make the diagnosis, name of disease, yeah. For example, if it is inflammation, what ending should we use?
Itis.
Itis. For example, if it is inflammation in the liver, how should we name it?
Hepatitis.
Hepatitis. Okay. If it is inflammation in the in kidney.
Nephritis.
Nephritis. Okay. And if it is
Meningitis.
meningitis, yeah. Okay. But if it is dystrophy, accumulations, yeah, the ending osis. Is it clear?
Yes, teacher.
Osis, right?
Osis. Yeah. Like hepatosis, yeah. Nephrosis. Okay. Next, one more fatty degeneration. You have to know tiger heart. Very important. Tiger heart. It is parenchymal. Yeah, it means intracellular fatty deposition. Intracellular, it means it happens in specific cells. What specific cells of the heart?
Papillary muscles.
Cells. I'm asking about cells.
Cardiomyocyte.
Cardiomyocyte. Therefore, tiger heart is characterized by accumulation of fat in cardiomyocytes. Yeah. First of all, yeah, fat deposition, exactly. Tiger heart, yeah, it's characterized, leads to enlargement of organ, and we have to exactly describe as according to the structure. Do you remember? Yeah, according to the rule. First of all, we have to tell about size. Therefore, the heart is enlarged. It is flabby, a little bit rounder. Yeah. It is chambers are stretched exactly because it is flabby, yeah, and fat deposition happens inside in cardiomyocytes. Yeah. How can we see macroscopically? Where should we find macroscopically cardiomyocytes? From which side of the heart?
From the ventricles.
From inside. Yeah?
Right.
Therefore, we should cut the heart because from outside, yeah, exactly, we cannot see anything. Just enlargement and flabby. Yeah. Therefore, we should cut the heart exactly and look inside in ventricles, in atrium ventricles, in chambers inside. Yeah. And which layer of the heart wall we can see exactly inside if we cut the heart?
Endocardium.
Endocardium. Therefore, we have to investigate the heart from endocardium side. Is it clear?
Yes, teacher.
Okay, and from endocardium, we opened it. Yeah, we cut and opened as a book. And we investigate exactly from endocardium side. Yeah. Sorry. Okay, from endocardium side. how do you think where exactly inside in the from chambers from endocardium side it will be thinnest endocardium. If it is the thinnest, it means that myocardium looks it is more visible. Yeah. Is it clear or not? Yeah,
Repeat that.
exactly. Through thin endocardium, yeah, we can see macroscopically condition of myocardium and where exactly it is the thinnest.
Near the atrium.
Papillary muscle.
In papillary or trabecular muscles, what are they? Where exactly should we find and what is the function of trabecular papillary muscles?
The ventricle.
The opening of the valves.
Yeah, therefore it's exactly muscles which are connected between the like visceral, exactly the side, this the visceral layer of the ventriculum and valve, yeah, and it is a function of it opening and closing of cusps, yeah, valvular cusps. Therefore, in tiger heart, first of all, we can see changing of Z muscles. A little bit later, muscles should we find in this patient?
The color of the muscle will get yellowish and the stripes of yellow and brown color is appear.
Stripes. Why is it tiger? Because tiger has stripes. Yeah. The same situation, not same exactly, yeah, but stripes, yellowish stripes.
Yeah.
We can see exactly as appearance of surface of these papillary muscles. Therefore, papillary muscles are striated. We can see yellowish patches, yellowish lines, stripes. Is it clear?
Yeah.
Okay, macroscopically, if we see it, we can understand that it is tiger heart. Yeah. After that, you have to explain, yeah, why can we see these yellowish stripes? It means that fatty deposition happens in some regions, not everywhere, because if fatty was accumulated, this fat was accumulated in every cardiomyocyte, the whole myocardium in that situation was yellowish, yeah, diffuse yellowish. But if we can see stripes, looks like line, it means that not all cardiomyocytes are affected. We can see some changed cardiomyocytes and normal, changed and normal. Yeah, it is local. It means that it is this dystrophy is local. It is in general. It happens. It doesn't happen in every cell. And you have to explain in your description where does it happen, in what cardiomyocytes, and why. It was a question. Are you with me or not?
I'm with you.
And why are you so quiet? Why is it partial?
Ma'am, can you repeat the question, please?
My question was about explanation why we can see yellowish stripes. why fatty dystrophy in tiger heart is local. Why and when? Because Michael
Because
fat
it is
deposition.
because it is specific to only endocardium, right? A part of endocardium, and
No,
there's
it
like
isn't.
partial.
Sure, due to chronic hypoxia, there will be decomposition of the cellular components of cardiomyocytes.
And
Why
is it local?
Local.
Yeah, local. Where exactly does it develop?
Teacher, in hypoxia, I guess the organ affected must be heart only, na? Because
heart, but in the heart we can see stripes. It means that not all cardiomyocytes are affected. It is local, yeah, like partial.
The coronary artery, it supplies. Coronary artery will supply blood, and the blood will diffuse. So all the arteries are not blocked. Only some capillaries can be blocked due to hypoxia.
I don't understand you at all.
No, it's maybe because only like specific fatty droplets.
By arterial blockage at all. If coronary arteries are blocked, it is another disease. It isn't tiger heart.
It is local because of like it's not complete deposition of fat droplets, right? It's only partially deposited, like some get deposited. That's why we have
where exactly fat deposition?
Endocardium or cardiomyocytes.
Why are you talking about endocardium? Is it endocardial changes?
Myocardium.
Cardium. Oh, yeah. Okay, yeah.
We can see just in myocardium. But not all cardiomyocytes are affected.
Yeah, it's partial deposition.
Correct way, in right way, but a little bit not full way you went, unfortunately. What happens? Partially it happens.
Yeah, partial deposition of fat droplets, right?
Okay, tell me please, but yeah, I have heard this answer. What mechanism? What mechanism does lead to tiger heart?
Abnormal synthesis.
What is abnormal synthesis?
No, it's not abnormal.
Decomposition. Because the teacher, due to hypoxia, the mitochondrial enzymes will come out and it will degrade the cell.
Yeah, decomposition because of hypoxia.
Yeah,
okay.
The cytoplasm gets replaced with the
fat
droplets. Yeah.
Okay, me place where exactly in the tissue hypoxia is higher. In which region of the tissue hypoxia is higher?
In the
or
ventricle.
not higher, where exactly in which region of tissue hypoxia develops first of all?
Inside. Inside.
Yeah, we are inside, exactly. We are talking about inside. But inside, some cardiomyocytes are normal, some are affected. And I am asking about, and it depends on hypoxia. And I am asking where exactly in the tissue hypoxia happens and dangerous. It is dangerous in this region. Hypoxia.
A random guess. Is it veins or something?
Surrounding by the veins.
Around venous vessels, around veins. Why? Why?
That's where the progression, that's where like the cytoplasm gets replaced with, as I said before.
Why around vein hypoxia is higher or develops first of all?
Because teacher, they deoxygenated blood and it's
Yeah, because
already...
oxygenated blood. Yeah, and what does oxygen do normally? Destroy lipids, fat. Yeah, and if it isn't enough oxygen, fat is not destroyed and accumulate exactly in cytoplasm. Is it clear or not?
Clear.
We can see why it is stripe, because exactly fat is deposits, accumulates in cardiomyocytes around veins. Closer to arterial vessels, cardiomyocytes are healthy because exactly, more oxygen in it. Is it clear or not? Is it clear or not?
Yes,
Are you
teacher.
with me? Yes?
Sure. Yes,
Okay,
teacher.
around veins, we can see fatty degeneration, yeah? And around arteries, we can see healthy cardiomyocytes. And macroscopically, it looks like stripes, yeah? Regions of fatty dystrophy, normal myocardium, fatty dystrophy, normal myocardium. Therefore, we can see fatty stripes. Okay, therefore, your description of tiger heart. Heart is enlarged, flabby, chambers are stretched, yeah? From endocardium side, we can see that papillary muscles are enlarged and striated. We can see yellowish stripes in it. Microscopically, we can identify fat accumulation in cardiomyocytes around veins because of decomposition caused by hypoxia. Is it clear? It is full description of tiger heart. How exactly it was your task, yeah? But you didn't give me full description. Is it understandable, your mistakes, according to
Yes,
it?
teacher.
Yes, how
Yes,
exactly?
doctor.
Okay, tell me please, give me an example of acquired glycogenosis.
Diabetes mellitus.
Yeah, diabetes mellitus is characterized by glycogen accumulation. Yeah.
Yes.
Okay. Do you have another questions? About carbohydrate also, it is a problem very often mistakes, not mistakes, not clear understandable. Yeah, it is this classification, unfortunately, for students sometimes. Carbohydrate dystrophy in intracellular, yeah. Two kinds of carbohydrates could be accumulated inside in the cells. It is glycogen and second glycoproteins. According to that, there are two kinds of carbohydrate parenchymal dystrophy intracellular. Yeah? Glycogen disorder and glycoprotein disorder. Every of them is divided. Glycogenosis, yeah, could be congenital and acquired. Acquired exactly develops in diabetes mellitus. Congenital, there are a few, 4 or 5 diseases you have to know. It is enough to to remember names. Yeah, Gierke, Pompe, names of diseases. Yeah, glycoprotein disorder. Also, it should be one example. It is mucoviscidosis. And second is colloid or mucous dystrophy.
Yes.
Is it clear, this classification? Yeah, because very often it's confused. Okay.
Teacher, can you repeat that the glycogen one acquired and the other is hereditary? The acquired is diabetes and hereditary is?
You can find diseases. Minimum 5 diseases. Yeah, you have exactly. You have a table in your workbook. I mean, the name of diseases according to authors. Yeah, researchers who had described this disease. Yeah, and they were named as Hirke's disease, Pompe's disease, McArdle disease, and other diseases. Yeah.
Okay, teacher.
Okay, do you have another questions about intracellular accumulations?
About mucoviscodiosis, is the same as the cystic fibrosis or is it different?
Cystic fibrosis, it is manifestation. Mucoviscidosis leads to cystic fibrosis. Yeah, it is just like local changes in the lungs and in other organs.
Okay, doctor.
Okay, what else? What another questions do you? Therefore, I will ask as we have talked already right now. Yeah, definitions of different kind outcomes. I can ask which outcome of hydropic dystrophy. What could it be? Yeah, and you have to tell that it could be reversible or it can lead to colliquative necrosis. Yeah. I can ask what is Mallory body, what is leukoplakia. In leukoplakia definition, if you define leukoplakia, don't forget about metaplasia. Yeah, you have to remember that it is kind like example of metaplasia. Okay, what else? It is not very big topic, but it becomes difficult, yeah, for the starting of studying this discipline. Next topics are longer, bigger according to the material. Yeah. Okay. Do you have questions or not?
Like about is anyone else asking?
Yes, me. Wait up. I would like to know if this information we talk now in the lecture, it's enough to answer your questions in the next class, or we should do something else also.
Yes, it's enough.
Okay.
Doctor, about you talked about necrosis in the starting. So you said like it's like dry and wet, like coagulative and liquefative. But like in another books, there are other type of necrosis. So do we need to study also that?
There are morphologically there are just two kinds.
Okay.
But also it is etiological. According to the cause, we can classify different kinds of necrosis. According to clinical manifestations, 3 kinds of necrosis. Yeah. Therefore, but according to morphological changes, what is the main? Coagulation of proteins or colliquations. Therefore, just two morphological kinds. It could be dry or wet. Morphologically, we don't have another. Yeah, it will be clinical. It's another classification, and etiological. The third classification. And as general, you have to know 3 classifications of necrosis.
Okay. About like 3 classification of necrosis. Can you just tell me that? Like you said, like.
But we will study after. intracellular, 2 more dystrophies, and in third lesson, yeah, in third lesson from today, we will have necrosis.
Okay, doctor. Thank you.
It will be
And teacher,
separate lesson. Yeah.
One last question. This leukoplakia is abnormal synthesis or transformation?
Abnormal synthesis, because this keratin, it isn't normal substance for mucosa.
Okay, teacher.
Keratin normally found only in the skin.
Okay, teacher. Got it.
Okay. What else? What another questions do you have? Okay, therefore, for the lesson, some of you have lesson tomorrow, some on Monday, yeah? You have to finish your workbook, yeah? Home task, I mean workbook, distant work, MCQs, do MCQs, yeah? And I will ask parenchymal dystrophy. Okay?
Okay, teacher.
Teacher, I want to ask, the parenchyma, is it just for intracellular or both intracellular and extracellular?
Is it proposition?
No, I'm asking.
Yeah, but I feel it as proposition.
No,
I can
teachers, not.
think. I can
Not
think.
proposition.
I can ask you everything. Even tomorrow, I can ask all 445 topics.
Teacher, have mercy.
I
Have
know
mercy
all
on us.
topics. I know all diseases, but I'm not sure about you.
No,
Therefore,
teacher,
how
No,
are you
teacher.
feeling?
it's not the proposition. It was just a question.
Just the question. According for tomorrow, I am going to ask parenchymal dystrophy. But in class, as class work, you will have extracellular accumulation.
Oh, okay, understood.
Understood, yeah?
Yes.
Okay, if you want to be faster, we can skip parenchymal dystrophy, leave it into summary, because after necrosis, you will have summary. It will be like conclusional lesson, a practical skills control about all previous topics.
Are we going to get mark for it if we skip it?
Why?
For parenchymal, it depends. I can put mark according to your home task, but is the maximum if you give me excellent answers in MCQs, homework, and distant work, you can have 3.
Okay, we keep it, teacher.
Yeah, we don't skip it. We don't want to skip it.
Okay, Devon, you can decide. It doesn't matter. You can tell me in the start of the lesson. It doesn't matter for me what exactly I will ask you. Extracellular or intracellular accumulations. See.
One thing, you gave us a few extra questions last lesson. Will you be including it next lesson or tomorrow?
First of all, in the lesson, I will ask according to our timetable, yeah, according to the decision, parenchymal dystrophy. If we have time, I will ask exactly your depths, but I'm not sure. According to practice, according to previous years, it isn't enough time usually.
So
How do we close it?
how do we do the questions that you left us, our depths? How do we close them?
Okay, yes, these questions, it's possible, it will be possible to finish everything in summary. In conclusion, practical skills control.
So far we don't have a mark for the previous lesson. We're waiting till the summary, till the...
No, you will have, because you have time to, yeah, but yeah, we as general, we together, we don't have time to close it. If I asked you, some of student, a lot of student have mark, yeah, but and they have chance to improve it. For example, now they have 3, and they can have a chance to improve till 4 or 5, yeah. And it depends on situation, because first of all, I have to put in register, yeah, and give this information in Dean office about your exactly marks, yeah. But also about your depths, yeah. Your conclusional summary mark depends on, yeah, because in summary, I will pay attention to your depths, what exactly you didn't finish. Is it clear or not?
Yes, ma'am.
Yes, doctor.
Yes, ma'am.
I think in progression we will understand better.